Hello and welcome to WTO Forum. Access to affordable medicines is among the major challenges facing governments in the developing world today. In 2003, the WTO's General Council enhanced and clarified rules which make it easier for generic drugs to be sold in developing countries facing health crises. The question today, 5 years on, have those rules worked as intended and made it easier for governments in developing countries to obtain the drugs they need for their populations? We're very fortunate to have with us today two experts on this matter. We have Sisule Mutsungu, who's the president of the board of directors of IQ Sensato, a research and think tank based in Geneva which deals with development issues. Welcome. And Greg Perry, the Director General of the European Generic Medicines Association. Gentlemen, welcome to you both.
Thank you.
Sisule, let's start with you, please. Your thoughts. 5 years on, is the record what it should be?
5 years on, as far as I understand, there's a first shipment today from Canada to Rwanda, which is the first developing country to ask to use this mechanism. And that shipment, if it has arrived, will treat about 21,000 people, first line regimen. Clearly, 5 years on, the idea when we had this discussion was to address millions of people. So if you are looking at 21,000 5 years on, there is clearly a big question as to whether this has worked. That means that I think we have to think about what the decision did. I think the challenge was you had trade negotiators trying to develop a decision for procurement of medicines. I think they went too far into procurement issues, which were not trade issues, but more procurement, and they didn't have the expertise really to make sure that what they were crafting would deliver the medicines where they were supposed to be. They were rather more concerned about the trade rules and how that relates to their interests as opposed to the actual delivery. So I think 5 years on, the question for the trade negotiators who put this together is, do they believe if they were asked to do this again, they would do the same thing? Or would they ask someone else actually to do it? I think that for me is where we stand 5 years on. There is more happening outside WTO, and I think in the later discussion I can come back to why I think we need to think differently now.
Greg.
I agree. I think we have a disappointment on our hands. One delivery in 5 years is not, I think, what was expected by policymakers. I have to say, from an industry point of view, we're probably not so surprised, because I think what I should do is explain the fact that it's actually a very restrictive provision that was created. It's restrictive in its administrative sense. It's a highly complicated legal and bureaucratic procedure that needs to be undertaken by a pharmaceutical company in order to export under a compulsory license to a country which has no pharmaceutical capacity to make the drugs. Secondly, the problem relates, let's say, from a market or commercial perspective. Because the drug can only be delivered to one country under a very strict specific regime, there is essentially a very limited market. It can't be exported to anyone else in the region. There's no long-term supply agreements. There are the possibilities that the actual agreement can be changed during the process. So from a company perspective, it's not at all a very inviting mechanism to use. So I'm afraid when you take the bureaucratic problems together with the market problems, you actually never created a solution in the first place. And we did warn various governments when they were looking at implementing this that this would be the case. And I'm afraid the result is as we had expected. It's disappointing, and I think we have to look totally changing the current system and focusing on other issues that exist.
Do you share that view?
I generally share the view that you have to think about, as we've said, 5 years on, delivery today in Rwanda, the first time, 5 years on, which can only treat 21,000 people for 2-year period at most. And if those people need its ARVs, if they need to shift to second line treatment, for example, another regimen, you would have to find a solution for that. How would they, where would the medicine come from? So I think, as I said, I agree that there is really need to think about what was proposed. Legally, it might look, I think, to lawyers, it looks fairly easy. There's this exception and that exception. But as I said, you had trade negotiators discussing procurement of medicines. And I think the understanding of the nitty-gritty of moving a medicine from one country to the other and what you need to do, the market questions that are involved were really not addressed. It was a political solution, in a sense, that I think we have to learn from about what was delivered.
It's correct. I'm afraid that the system may look like it's very well devised from a legal perspective, but from a practical perspective, both from a public health point of view and I think from a commercial perspective, it's unworkable. And
what can be done?
Well, I think the first thing that needs to be done is to, if I can say, go back to the drawing board and look at a much more flexible approach. I think we need speed of access to the market. We need to have probably a bigger market in place as well. So we're not looking just at providing a product for one country, maybe on a regional basis. And thirdly, I think we need to have some long-term commitments. Companies have to invest in API supply, manufacturing, development, and shipping over. And I think they need to have the security. And I think with that, we could probably look at linking it up more with funding aspect. So it actually, you link up this provision with a direct funding proposal that may come from one of the international institutions. In my opinion, the scheme was over-marketed. It was a small change in the TRIPS agreement, which was required, but I think it was completely over-marketed and the expectations were far too high. There are many other things that we can look at that are in TRIPS and in public health that are probably much more important, and I'm afraid I think policymakers have lost sight of those other things.
Fairly harsh condemnation.
Yeah, and I think, as Greg says, it had been a long process to arrive at the decision. And so when finally there was a decision, obviously everyone was happy about it and it was hailed as a solution. I think if you think about the debates, we just had some of that in the WTO forum in the sessions. Is the question, was it what the ministers wanted was an expeditious solution. Now the question is whether expeditious means 5 years, one shipment. The other question really is, I think it's been repeatedly said that this was a legal solution in a way, but there's a lot of political and economic factors that affect the actual use of the compulsory licensing. So even if in technical terms you have legal rules that appear to be workable, you have to think about the political rules, and questions have been raised about the impact of, for example, the letters from Commissioner Mandelson of the EU to Thailand when Thailand used a compulsory license, that has had a political chilling effect, even if they were rules, has had a political chilling effect on the ability of other developing countries to use this decision. So unless a country believes that it has all the political backing from other players, they are not very sure to do this. And we've been given examples about NGOs which want to use this, but they really have to talk to the head of state for them to be sure that there's political backing to go ahead with this. So I think those other factors, political and economic, are what was missed in thinking about expeditious solution in this. And if something is done now, apart from, I think we need to look at the broader range of flexibilities to use. If something is done now, it needs much more better technical input into the process to guide the decisions of the negotiators.
Greg, your final thoughts.
My final thoughts, I really do hope that the policymakers will seek to revamp this whole compulsory licensing issue. And we're talking about for export. That's one thing. I think compulsory licenses for national production by those countries which can actually produce, there should be a lot more political support for this flexibility in TRIPS. And I think there's just been not enough support for the whole concept. But I think there are other bigger issues, there are trade issues we have to look at, and it is really essential that the market exists in such a way that, that generic production can be effective and brought to the patient as quickly as possible.
So Sule, you have the last word.
I think to conclude, for me the question going forward is the role of WTO in the question of access to essential medicine and intellectual property going forward. 5 years on, if there are really big questions about whether this is working, we have to think if it was done properly. We can compare this to the WHO process, where we saw a special commission created with technical input through a process that took 4 years before the ministers of health came to a decision about what they want to try and do. And I think going forward, WTO, if something is done here or if WTO is still relevant, what will be the technical input and process that gives us a solution that works, as opposed to a political solution that appears nice on paper but doesn't deliver.
Sisule Musongo, Greg Perry, gentlemen, thanks very much. And thanks to you for watching WTO Forum.